So the presentation that I've prepared for you all is really just to kind of explain where we came from as a pharmacy and where we've come to now, I guess. We started out as a full-fledged dispensing pharmacy and then morphed into what we are today, which is really what I'll be talking more about, and that's medication care management. It's beyond the scope of a traditional dispensing role and a pharmacy. This slide will give you a little bit more about what we are today. So as I mentioned before, I joined right after my residency. I joined PPA. They had just opened their doors in 2002, and we were founded as a dispensing pharmacy, solely closed-door dispensing pharmacy. As years progressed, we found our niche, and our niche was working with those patients and physicians that were in the Medicaid arena, those that were impoverished, those that had less health literacy, those that didn't have the access and services to be able to get their medications and stay adherent to what they were doing. So our focus very quickly became on that population. And now, moving in the last 3 to 4 years, not only working with the state in their Medicaid population, but we found that working with those managed care organizations and government programs that, house these populations were very good partners in what we were doing, and we had a lot of services to offer them as both as client and as a vendor. So as you can see, we've moved forward, and we're working with a lot of fee-for-service Medicaid, which is not in many states, and then also now with managed care in multiple states. And we are currently serving about 7 states, and North Carolina and South Carolina, to be specific, still have some fee-for-service business in which we're working with the state Medicaid arena, but then in the other states, primarily working with the managed care organizations that recognize the value add that PPA can bring to their patients and their members, and then ask us to come in and execute our service. And I'll talk a little bit more about that in just a moment.